Hey everyone, ready for a deep dive into a topic that's pretty heavy?
Definitely important, though.
Absolutely. We're going to be talking about suicide, and specifically how it relates to chronic illnesses. But here's the twist,
We're focusing on Brazilian hospitals.
right? And our main source for this deep dive is, get this, a book called Livro Karla Suicidio Final.pdf.
Catchy title, huh?
It's written by a psychologist named Karla, who has like over a decade of experience working in hospitals.
Both public and private, which gives her a pretty unique perspective.
Totally. So in this book, she really digs deep into what healthcare professionals are thinking and experiencing when it comes to suicidal behavior in patients.
And she noticed something interesting throughout her career,
What's that?
that medical teams often have this, I guess you could say, laser focus on the biological side of illness.
Yeah, it makes sense though, right?
Totally, got to treat the disease. But sometimes that focus can overshadow the emotional turmoil a patient might be going through, especially when facing a chronic illness.
It's like treating the disease, but forgetting about the human being, right?
Exactly. And that's where the problem lies. See, the book points out that many healthcare professionals haven't received specific training on how to deal with suicidal behavior in patients who are also struggling with a chronic illness.
Oh, wow. That's a little alarming, especially when you consider how chronic illnesses and suicide rates are both on the rise in Brazil.
Yeah, and that's exactly what piqued Carla's interest. She saw these two trends kind of colliding within hospitals and felt like, compelled to explore it further.
Makes sense.
So, to get a better understanding of what's going on, she dove into a ton of international research.
How much research are we talking?
We're talking 43 studies published between 2006 and 2016.
Wow. That's impressive.
Right. And these studies cover a wide range of topics, everything from individual case studies to risk assessment and prevention strategies.
Okay, so 43 studies. Were there any that were particularly powerful or interesting?
Well, there's this one that always sticks with me. It was about a patient who attempted suicide using their own diabetes medication.
Wow, that's heavy.
Yeah.
I mean, it really makes you realize how serious this whole issue is.
Absolutely. And what's even more concerning is that this lack of awareness about the link between chronic illness and suicide risk, well, it kept popping up throughout the research.
It sounds like there's a huge need for more education and training, not just on treating the physical illness, but understanding the whole person, right?
100%. But hold on, there's more. Karla didn't just stop at analyzing research papers.
You went further.
Oh, yeah, she got up close and personal, conducting interviews with all sorts of healthcare professionals.
At an actual hospital.
Yep, right here in Brazil, at a university hospital. Doctors, nurses, social workers, even speech therapists. She wanted to hear from everyone.
That's smart, getting those diverse viewpoints. And how did she go about making sense of all those interviews?
She used something called discourse analysis, which is basically a way of digging deeper into what people say to try and uncover those hidden meanings and emotions, even the things left unsaid.
Like reading between the lines, which is super important with a topic as sensitive as suicide.
Exactly. And speaking of getting personal, you know how some researchers keep field diaries during their work?
Oh yeah, those can be fascinating.
Well, Karla kept one too. She describes the hospital atmosphere, the reactions she got from professionals, and even some of the roadblocks she hit.
I can imagine. Hospitals aren't exactly known for being calm and relaxed.
Tell me about it. Like one time, she couldn't even find a private room to conduct her interviews. And don't even get me started on getting permission from certain higher-ups. It was a whole ordeal.
So she had to deal with a lot of bureaucracy.
Tons of it. She even mentions one time where she was completely ignored by a head nurse, too busy gossiping on the phone to even acknowledge her.
Ouch. But I bet there were also people who were really receptive to her research, right?
Oh, absolutely. She talks about this one nursing assistant who was super excited about the project and eager to share their experiences.
That's good to hear. It shows that even in a busy, sometimes chaotic environment, people are thinking about these issues and want to be part of the solution.
For sure. So now that we have a sense of Karla's journey, let's talk about what she actually learned from those healthcare workers. What were their thoughts and experiences surrounding suicidal behavior?
Okay, let's get into that. Did she find any common themes or patterns in their responses?
Well, one thing that jumped out right away was just how diverse their understanding of suicide was, and sometimes even contradictory.
Contradictory? How so?
Some professionals viewed suicide as this passive choice, like the patient was simply giving up.
I can see how that perspective might arise in a hospital where people are constantly fighting for their lives.
Right. But then other professionals saw it as this very deliberate act, like a conscious decision to end suffering.
Wow, that's such a different interpretation.
It is, right. And Carla really emphasizes that to understand someone's situation, we need to look at the context of their life, their struggles, their pain.
We can't just make assumptions about something as personal and complex as suicide.
Exactly.
So, besides these different perspectives, what do they say about the actual factors that might contribute to suicide risk?
Well, they pointed to several key things. One was the emotional distress that often comes with a chronic illness diagnosis.
Yeah, that makes sense. Just imagine the weight of receiving a serious diagnosis and knowing your life will never be the same.
Exactly. Then there's the pressure from family and society, the expectations and
Oh,
judgments.
yeah, like feeling like a burden.
Exactly. And those fears can become really overwhelming, which is why it's crucial for healthcare providers to offer empathy and support, not just medical treatment, but emotional support too.
So they need to address both the physical and psychological aspects of care.
Precisely. Now, Carla actually organized the healthcare professionals' responses in a really interesting way.
Hmm.
She called it the movement of healthcare professionals' discourse. And within that, she grouped their statements into what she called significant nuclei. These nuclei are like themes or patterns that emerge from their words.
And these nuclei helped her to understand how they approached managing suicidal patients.
Exactly. One of those nuclei was, you guessed it, professional experiences. That's where they shared their stories, their encounters with patients expressing suicidal thoughts, even engaging in dangerous behaviors.
I bet those stories were tough to hear.
Oh, definitely. And Carla shares some pretty intense examples, like a patient who tried to jump out of a hospital window after heart surgery.
Oh my God, how terrifying.
Right. And unfortunately, most healthcare professionals, they simply don't know how to react effectively in these situations. They feel scared, unsure, sometimes even indifferent.
That's heartbreaking.
It is. It just goes to show how much more awareness and training is needed on how to deal with this issue sensitively.
And speaking of sensitive issues, I'm curious about how those healthcare workers approached the topic of death, especially in a hospital where, it's a constant reality.
That's a delicate aspect of Carla's research. What she found was that death is still very much a taboo subject for many healthcare professionals.
It makes sense, though. Our society as a whole isn't very comfortable with death.
Right. And in a hospital where the focus is on preserving life, this avoidance is even more pronounced.
So it's like they're trained to fight death, and when it happens, it can be seen as a failure.
Exactly. It's this complicated emotional burden they carry. And there's one story Carla shares that's especially powerful. It's about a healthcare worker who witnessed the suicide of a medical student who had just tested positive for HIV.
Oh, wow. I can't even imagine how traumatic that would be.
It's devastating, and it highlights just how deep this taboo runs. Carla even brings up the work of sociologist Norbert Elias, who wrote a whole book about it.
The loneliness of the dying.
Yes. Elias argues that we've become so uncomfortable with death in modern society that we isolate those who are dying and avoid talking about it altogether.
And how does that connect to the issue of suicide?
Well, Carla suggests that if we can't even face death as a natural part of life, how can we possibly understand and support someone who's actively seeking to hasten their own end?
That's a deep point. It seems like open and honest conversations about death are crucial, both in society at large and within the medical community.
I couldn't agree more. So with that in mind, why don't we shift gears and talk about what those healthcare professionals suggested could be done to improve care for patients at risk of suicide?
Yes, let's get into that. What kind of solutions did they propose?
One common theme was the need for comprehensive training programs to equip healthcare workers with the skills to recognize, address, and support patients at risk.
Yeah, it's clear from the stories we've heard that many of them feel lost and unsure of what to do.
Exactly. They need the knowledge and the confidence to handle these situations effectively. And Carla also emphasizes the importance of a more human-centered approach to healthcare.
So moving beyond just treating the physical symptoms and seeing the patient as a whole person.
Exactly. They also suggested practical measures like implementing safety protocols within the hospital.
Like what? More security guards.
Well, things like window bars, secure doors, making it physically harder for someone to attempt suicide while in the hospital.
Right. But as we've said before, those measures are only part of the solution. It's about creating a compassionate environment, a place where patients feel safe to open up.
Absolutely. A fortress of a hospital won't help if the staff isn't trained to deal with the emotional and psychological needs of their patients.
And Karla, she goes even further, doesn't she? She questions our whole approach to life and death in this book.
She does. She challenges us to think about the excesses of medicine, those invasive treatments that sometimes prolong life without necessarily improving its quality.
It's that age-old question. Quantity of life versus quality of life.
Exactly. And Karla leaves us with that challenge, urging us to strive for a more humane approach to healthcare.
This book is really giving us a lot to think about.
It is, and there's still so much more to explore. In the next part of our deep dive, we'll delve even deeper into the words of those healthcare professionals, analyzing their language and uncovering those hidden nuances in their perceptions of suicide.
Can't wait to unpack that. So everyone listening, be sure to tune in for part 2 of our deep dive into Livro Karla Suicidio Final.pdf. We'll see you soon.
Welcome back, everyone. Hope you're ready for round 2 of our deep dive into Karla's book.
You bet. Last time we got a feel for her research process, peeked into her field diary, even saw how suicide in hospitals is often this hush-hush, super complicated issue.
Definitely. And this time I want to dive deeper into those interviews she did with the healthcare professionals.
Yeah, let's get into that.
Remember those categories Karla organized their responses into? We touched on professional experiences, those heavy stories of in-hospital suicide attempts.
Powerful stuff. Really showed the need for open conversation.
Absolutely. Today, let's explore understanding suicidal behavior.
Intriguing. What did Karla uncover there?
She found these professionals had really different ways of understanding suicide. Some linked it directly to mental illness, like it's a symptom, pure and simple.
So they saw it as a purely psychiatric thing.
Exactly. And while that's not entirely wrong,
It's a bit limited, right?
you got it. Like we talked about before, reducing it to just mental illness ignores all those other factors. Social pressures, economic struggles, you name it.
Even existential crises, right?
Totally. Karla actually gives this example in the book that shows how this narrow view can be, well, kind of harmful. A healthcare worker asked about a patient's suicide, just went, oh, he was mentally ill, nothing we could do.
Whoa, talk about dismissive. Like they completely shut down the human element.
It's rough. Shows how lack of knowledge can lead to these snap judgments, creating distance between caregivers and patients.
So how do we fight that stigma, that oversimplification of something so complex?
Karla's a big advocate for more education, more training for healthcare professionals. We got to demystify suicide, show it's this multifaceted thing, give them the tools to address patients' mental and emotional needs.
Makes total sense. Did she find any other perspectives on suicide from those workers, though?
Thankfully, yeah. Some showed a much broader understanding, recognizing it's influenced by all sorts of things, social, cultural, personal circumstances, a whole picture.
Okay, good to hear. Not everyone's stuck in that narrow mindset then.
Right. But here's the catch. Even among those who got the complexity, there's still hesitancy to actually engage with it, practically speaking.
What do you mean? What holds them back?
Seems like many feel overwhelmed, unprepared to handle a patient who's expressing those suicidal thoughts, that level of suffering.
Yeah, I can imagine. Must be tough to know what to say or do in that moment.
Exactly. That fear, that uncertainty, it can lead to avoidance, denial, all that.
So what's the solution? How do they overcome that feeling of being stuck?
Karla emphasizes open communication, creating safe spaces for dialogue within the hospital itself. Professionals got to feel comfortable sharing their doubts, fears, all that without judgment.
Makes sense? Got to remember, they're human too.
Yeah.
Dealing with heavy stuff day in and day out.
Exactly. She even suggests hospitals should offer psychological support specifically for their staff.
Ooh, interesting. Like a form of self-care for the caregivers so they can better care for others.
Spot on. Speaking of which, Karla highlights something super important. Reclaiming the subjective dimension of healthcare.
Subjective dimension, what's that mean exactly?
She observed that often hospital care gets so fixated on treating the physical body, the disease itself, that they forget about the individual person going through it.
Ah, the old treating the disease, not the patient problem.
Right. She wants holistic care, considering the patient's whole life story, fears, dreams, seeing them as, well, a human being, not just a bunch of symptoms.
That's a beautiful way to look at it.
Yeah.
But how do you actually put that into practice?
Simple things, really. Karla suggests providers really listen, build rapport, offer empathy, show compassion.
Those little things can mean so much to someone who's feeling lost hopeless.
Exactly. A kind look, a comforting word, it can make all the difference.
Maybe even prevent someone from taking that drastic step towards suicide.
You got it. Compassionate care, human-centered care can be a protective factor in itself. Now, did you ever wonder if a healthcare worker's background, their training, impacted how they saw suicide?
Ooh, that's a good question. Did Karla look into that?
She did. Medical specializations seem to play a role.
Really? How so?
Intensive care docs, for example, who deal with death a lot, they tended to have this more pragmatic view of suicide. Psychiatrists focus more on the psychological stuff, naturally.
Makes sense. Different lenses, different focuses.
Right. But Karla points out this diversity of thought can be good, as long as there's open communication between all those medical fields.
It's about working together to understand the whole person, not just their illness.
Absolutely. Integrated care is key. Now, outside those healthcare folks, did Karla bring in any other perspectives on suicide, like theorists, authors, anyone like that?
It would be interesting to compare those direct experiences to bigger philosophical or sociological ideas.
Well, you're in luck. She references some big names like Freud, the psychoanalysis guy,
Oh, wow, Freud.
and Durkheim, one of the founders of sociology.
Okay, what did they have to say about suicide?
Freud linked it to something called the death drive, this primal instinct pulling us back towards like a non-living state.
Whoa, that's intense.
Right. He also talked about how important grieving and processing loss is to prevent suicide when we don't do that properly.
We turn that destructive energy inwards.
Exactly.
Yeah.
Durkheim had a more social take. He examined how societal things like lack of belonging, lack of purpose.
Like feeling disconnected from society.
Yeah, he called it enemy. This breakdown where norms and values lose their grip on people. It can lead to that feeling of isolation, meaninglessness, which, you guessed it.
Can increase the risk of suicide. We see that play out all the time, right? Social unrest, economic downturns. It takes a toll.
Totally. And Karla uses these guys, Freud and Durkheim, to show that suicide isn't just some isolated act. It's got psychological, social, cultural roots. It's complicated.
It's like those individual stories from the healthcare workers tie into these bigger societal trends.
All connected. And Karla uses these different lenses to show us the big picture. We got to understand all that complexity if we want to come up with solutions that actually work.
Makes sense. Understanding comes before solving. Did Karla bring in any other thinkers?
One more. You'll appreciate this one. Norbert Elias, remember?
The Loneliness of the Dying Author.
Yeah. That's him. Karla uses his work to discuss how our modern squeamishness around death actually makes it harder to talk about suicide openly.
It's like we can't address suicide because we're too scared to even talk about death in general.
Exactly. Karla wants us to reclaim those conversations, face our mortality so we can approach suffering of any kind with more openness, more compassion.
It's about embracing all of the human experience, even the tough parts.
Beautifully put. That really gets at the heart of Karla's work. To wrap this part up, I want to highlight something she emphasizes throughout. Communication.
Like encouraging more open discussion about suicide.
Yes, but more specific, too. She wants healthcare providers to have clear, empathetic communication with at-risk patients.
What does that look like, practically speaking?
Simple stuff, but powerful. Take time for real conversations. Show genuine interest in their lives.
Not just a quick checkup, but real connection.
Exactly. Validate their feelings, whatever they are.
Even if it's sadness, anxiety, all that.
Yep. And they gotta feel safe to express themselves without judgment.
But isn't that risky? Like encouraging those negative feelings.
Karla's clear. Validating doesn't mean agreeing or condoning. It's saying, I see you, I hear you, I'm here.
Offering that sense of understanding.
Right. And practical support, too. Connecting them to resources, helping with daily tasks. Those small things matter.
Little acts of kindness can go a long way.
They do. And she stresses this isn't a one-time thing. Supporting a suicidal patient is ongoing, a constant process. Did those healthcare workers have any ideas for improving her own response, by the way?
Ooh, I'm curious what they suggest.
Creating clear protocols for handling suicidal patients came up a lot.
Like a step-by-step guide.
Exactly. Standardize the care, make sure no crucial steps get missed.
Yeah, that makes sense. Especially since many felt unsure how to act in those moments.
Right. These protocols could even incorporate those safety measures we mentioned, window bars, all that.
Right. But like we said, physical stuff is just one layer. It's got to be backed up by that culture of compassion, that feeling of safety to open up.
Couldn't agree more. And Karla reminds us, preventing suicide isn't just on healthcare workers. It's on all of us.
It takes a village, right? Spot the warning signs, support each other, break down that stigma around mental health.
Exactly. Karla's book is a great starting point for those conversations.
This whole deep dive has been really eye-opening.
It has. Before we wrap up, any big takeaways that stuck with you?
For me, it's got to be that focus on bringing back the human side of healthcare. Treat the whole person, not just the disease.
Love that. You think Karla's work helps move us towards that?
Definitely. She pushes for a kinder, more understanding approach to suicide and to healthcare in general.
I'm so glad to hear that. How about we leave our listeners with a thought to chew on?
Sounds good. How about this? How can we, as individuals and as a society, make healthcare more humane, more compassionate?
Perfect. Something to think about as we head into the final part of our deep dive. Next time, we tackle managing situations where suicidal behavior is observed.
Looking forward to it. See you all soon for the last part of our deep dive into Libro Karla Suicidal Final.pdf.
Welcome back for the final part of our deep dive. Ready to wrap up our exploration of Karla's book on suicide and chronic illness in Brazilian hospitals?
Absolutely. We've covered so much ground already, Karla's research journey, the different ways healthcare professionals see suicide.
We've seen just how complex this whole issue is, especially in a busy hospital setting.
And today we're finally getting into the nitty-gritty, how those professionals actually handled things when a patient was at risk.
Exactly. We're tackling that last category Karla identified. Managing situations where suicidal behavior is observed. And like the other categories, there's no single answer here.
So what were some of the common ways they responded?
One of the most frequent was referring the patient to psychiatry or psychology.
Basically calling in the mental health experts.
Yep. And that's definitely important, getting the patient connected to specialized care.
But is that enough? Does it sometimes let other healthcare providers off the hook? Like they've done their part by making the referral?
That's a critique Karla brings up. Mental health shouldn't be this separate thing, a department other people deal with.
Right, like we talked about, it needs to be integrated into all levels of care.
Exactly. Managing a suicidal patient goes beyond just passing them off. It's about giving those on the front lines, doctors, nurses, everyone, the tools to offer immediate support.
Okay, so what does that look like practically? Did Karla give any suggestions?
She did. Like, really making time for a genuine conversation with that patient, showing you're truly interested in their experience.
Not just a quick, how are you feeling, but actually connecting.
Exactly. Showing you care, that you're there to listen without judging, and validating their feelings, whatever they are.
Even if it's sadness, despair, all that.
Even then, that patient needs to feel safe to express themselves without being shut down.
But doesn't that risk, making those feelings stronger?
Karla's clear. Validating doesn't mean agreeing with them or saying their actions are okay. It's simply acknowledging those feelings are real to them in that moment.
It's like saying, I hear you, I see you, I'm here with you.
Exactly. And offering practical support too, like helping them connect with resources, reach out to loved ones, even just organizing daily tasks.
Those little things can be huge when you're feeling overwhelmed.
Totally. And Karla emphasizes this is ongoing, not a one-time fix. Supporting someone at risk takes constant attention. Did those healthcare workers have any ideas themselves, by the way, for what could be done better?
I'd love to hear that, like what they wish they had.
Well, creating clear protocols for these situations came up a lot.
Like a step-by-step guide on what to do.
Exactly. Standardize the care, make sure nothing gets missed.
That'd be huge, especially since so many felt unsure how to handle things.
Right. Those protocols could even include the safety measures we talked about, like window bars and such.
But as we said, that physical stuff is only part of it. It's got to be paired with that compassionate environment so people feel safe to open up.
Couldn't agree more. And Karla ends this section with a powerful reminder. Preventing suicide isn't just on healthcare workers, it's on all of us.
Like, it takes a village.
Exactly. Be aware of the warning signs, support the people in your life, work to break down the stigma around mental health.
Wow, this whole book has been so insightful.
It really has. It's been amazing to explore Karla's research with you and share it with our listeners.
Before we go, how about we recap what we've learned?
Perfect. We started with Karla's motivation for this research, those rising rates of chronic illness and suicide, and her focus on hospitals.
Then we dug into how those professionals understood suicide. Some had that narrow view, others a broader one.
And finally, how they actually responded to those patients at risk, the importance of going beyond just referrals, creating that supportive space.
We really did cover a lot.
We did. Karla's message is clear. Talk about suicide openly, fight the stigma, and offer real care to those suffering.
See the person, not just the illness.
Beautifully put. To everyone listening, please keep these conversations going. Read Karla's book, learn about suicide prevention, talk to your loved ones.
And be kind to each other.
Yes, kindness matters. Thank you all for joining us on this deep dive. Until next time.